Welcome to Module 7. In this section of the course, we're going to discuss the relationship between substance use and sexual risk behaviors. And this might feel uncomfortable for both counselor and client, but sexual health, impaired judgment, and consent and relationship dynamics, they're all important. Substance use is going to affect our decision-making and our impulse control, our personal boundaries, our risk perception. And so if you're under the influence, you might engage in some risky behaviors that you wouldn't choose to do when you were sober. And that doesn't mean that every person who uses substances is going to engage in unsafe sexual behavior, but it does mean that the counselor should approach these conversations with assumptions or even stereotypes. It doesn't mean that, but instead the goal is kind of to understand how substances may increase vulnerability and how the counselors are going to discuss these issues professionally and without shame. Because a lot of our clients already experience shame or embarrassment or even fear about discussing their sexuality or their trauma histories or even the sexually transmitted infections that they've gotten or past behaviors. And so if we appear judgmental or uncomfortable or dismissive about it, they may avoid important conversations entirely. So we're going to focus on how substances affect judgment, how it's overlapping, the substance use and the sexual risk, consent and vulnerability concerns, emotional factors that are influencing people's behaviors, and how counselors can approach these topics ethically and professionally. Because the goal here is not moral judgment, it's just safety and education and healthier decision making. So one of the most significant ways substance use affects sexual risk is through impaired judgments. A lot of our clients, their brain functioning is altered in ways that reduces their inhibition and increases their impulsive behavior. So people who are under the influence may take risks that they normally would avoid. They struggle to assess consequences clearly or prioritize immediate pressure or emotional connection over long-term safety. Alcohol, stimulants, opioids, cannabis, all types of substances affect decision-making differently, but they share the common effect of reducing the self-protective behavior. And so clients may engage in unprotected sex with unfamiliar partners, multiple partner situations, or sexual behavior that they later regret. And the substance use may also increase emotional vulnerability and impair communication skills, and that's going to make it harder for people to set boundaries clearly or advocate for themselves. So as counselors, it's important for us to discuss these realities factually rather than judgmentally. Those shame-based conversations lead clients to become defensive, and they're going to start minimizing their behavior and avoid honesty altogether. So the goal here is not to lecture the clients, it's to increase awareness and reduce risk and support healthier decision-making over time. And the substance use is going to increase sexual risk in several ways. One common issue is the reduced likelihood of using protection consistently. They may forget condoms, not use them, minimize the concerns about STIs in the moment, and that's going to increase the likelihood of them having multiple sexual partners or anonymous sexual encounters, or even situations where, communication is limited or just unclear. And even in some cases, people may engage in transactional sex, just exchanging sexual activity for money or substances or housing or transportation or safety needs. So it's important that we approach these conversations without moral judgments. A lot of clients involved in these transactional sex situations, they're operating from survival needs, trauma histories, infections, homelessness, coercion, financial desperation, and judgmental reactions from counselors kind of reinforce that shame, and it discourages honesty. And the clients who are fearing criticism may withhold important information that directly affects the treatment planning or the safety or any healthcare referrals that we give them. And their substance use also can increase vulnerability to other STIs, which then further increases HIV transmission risk because, of the tissue irritation, the inflammation, the sores, whatever. And so we don't need to become sexual health educators in the medical sense. But we do need to understand these overlaps are going to help support more effective behavioral health care. Another thing connected to substance use and sexual behavior is consent. Substances impair a person's ability to understand situations clearly, communicate their boundaries, recognize that they're in danger or that they have become a dangerous person, and really make informed decisions. And that increases vulnerability to coercion, exploitation, unsafe situations, assault, whatever. And there's been clients that have disclosed blackout states, memory gaps, regret, pressure from other people, trauma that's connected to those sexual experiences while they were intoxicated. And so we have to treat these disclosures carefully without victim blaming language like, why did you go there? Or why didn't you leave? Or why didn't you protect yourself? You are unintentionally reinforcing the shame and trauma when you do that. So trauma-informed counseling recognizes that intoxication may significantly reduce a person's ability to respond effectively in those unsafe situations. And our clients are also experiencing confusion, and they're guilty and feel like that self-blame about these experiences. So we need to focus on emotional safety and support and empower these clients, and then give them appropriate referrals when they're needed. And sexual behavior is not only influenced by physical attraction or substance use. There's emotional factors that play a major role. People are trying to seek validation and cope with loneliness or manage their emotional pain. They feel rejected sometimes, so they're trying to reduce those feelings of rejection. They're trying to create a temporary emotional connection with someone else. And then the trauma histories are affecting their relationship patterns, their attachment styles, their sexual decision-making. Like clients with histories of abuse or abandonment or neglect, or like even unstable relationships, are going to struggle with setting boundaries and their own self-worth. And they're not going to be able to recognize healthy or unhealthy dynamics. They're probably going to lean more toward the unhealthy dynamic. And the substance is going to intensify the emotional vulnerability because it lowers their inhibitions and it increases the emotional impulsivity. So as counselors, we have to recognize that sexual behavior is often connected to deeper emotional needs rather than just simply reckless choices. And understanding those dynamics is going to help counselors approach conversations with empathy and curiosity rather than judgment. We're not avoiding accountability. We're just understanding the full context surrounding behavior. And shame is one of the most powerful boundaries to honest communication about sexual health and substance use, because the client fears that they're going to be labeled or rejected or embarrassed or whatever, or maybe they feel like they're going to be misunderstood. But we want, and when that happens, the clients are going to feel like they need to shut down. And that's going to create behavioral health risks. So they're going to avoid HIV or STI testing because they're afraid of what the positive result means, or they minimize their behaviors during assessments because they fear judgment. And so we need to recognize the shame and create a non-judgmental environment. Simple counselor behavior matters. Calm tone, neutral facial expression, respectful language, avoid the shock reactions. Clients are often highly sensitive to that perceived judgment. And we may feel uncomfortable discussing sexual health topics because these conversations were not openly modeled in our own lives or our own training experiences. So we need to just remain calm, be respectful, be direct, and clinically appropriate. We don't want to make assumptions here about anything, gender identity, relationship structures, behavior patterns, none of that. We want to ask open-ended questions. Can we talk a little about sexual health concerns? Or have substances ever affected your decisions in your relationships? Or are there situations where you felt unsafe or vulnerable? The goal is not to invade their privacy unnecessarily. It's just to create a space where clients can discuss relevant concerns honestly if they choose. And we play a big role in helping them explore those risk behaviors and those emotional patterns and healthier coping strategies. So we use psychoeducation and emotional support referrals, discussing risk reduction, helping the clients process their behavior patterns. We're not providing medical diagnosis, obviously. So professionalism is going to be, balancing the honesty and the empathy and the appropriate boundaries. And the clients are going to benefit when we can approach these sensitive topics with calm confidence rather than discomfort or shame. So as we're closing out this module, remember that sexual risk behaviors often involve far more than impulsive choices alone. Substance use, trauma history, emotional needs, loneliness, impaired judgment, social pressure, they're all influencing a person's behavior. And when we understand these complexities, we're better equipped to create emotionally safe conversations that are supporting the client's healthy decision-making and reducing their shame. So in the next module, we're going to focus specifically on myths, misinformation, and fears surrounding HIV, including common misconceptions that counselors may encounter in behavioral health settings. So when you're ready, proceed to Module 8.